In this video, I'm going to go over the knee model right here. Now, before I start, I'm going to go to full screen mode, which is this button. I want to go over the controls. This is play. It will rotate it for you. Now it's a stop button, so it will stop it for you. And this rotates it a little bit to the left. This rotates it to the right. And then there are these colored pluses. They managed all to get in the right place. I don't know how. But that will tell you what those are. And you'll notice this looks like it's all sideways. That looks like it's sideways. I might have actually taken this as a portrait shot. All the rest are landscape. And it wouldn't let me display it. So there's actually something rotating this whole frame 90 degrees, which makes this rotation a little bit... Oh, I'm doing it now, of course. I go live. It works perfectly. So you might want to actually use the arrows for this. So let's go to the big screen. So there are my arrows that are all there. And see, when I went to the big screen, it went back to the other mode. So this is the knee. And this is the lateral side of the knee. I know it's the lateral side because I have the head of the fibula right here. And the fibula is always on the lateral side. Don't let the Halloween skeletons tell you otherwise. So this is the lateral condyle. And this is going to make a planar joint right there. So that's a planar joint between the two. Now, this is the patellar surface. The patella is right there. It would fit in nicely right there. And as we rotate, we see the medial condyles of both the... Does that help? We see the medial condyles of the femur and the tibia. So here I'm going around more. That is the medial condyle of the femur, medial condyle of the tibia, lateral condyle, head of the fibula. So let's actually start with this view. So the knee is a hinge joint. We have this menisci in here. This is the medial meniscus. That's the lateral meniscus. And it allows for a little bit back and forth, but it's more to help two condyles fit together. So this is primarily a hinge joint. There are two extracapsular ligaments. This is on the lateral side, and it's called the lateral collateral ligament. It goes from the lateral epicondyle right there to the head of the fibula. Head of the fibula we'll learn is really busy in the muscle chapter too. So this is the LCL. Now I learned fibular collateral ligament because it's attached to the fibula, but in medicine it's always lateral collateral. On the other side here, we have one going from the medial side of the bone. So we are going from the medial epicondyle to the proximal tibia. And that is the medial collateral ligament, or MCL. This a lot of athletes rip. So it's also the tibular collateral ligament. Again, you're only going to hear MCL in medicine. So those are the collateral ligaments. Then there's two intracapsular ligaments. You can see the first one right there. It's going from the proximal tibia to the back. That is that ligament coming from the front. And then we have this other one, not this one, here, going from the posterior tibia. And it's going to attach to the femur as well. So here it's looking from a close-up. There's the lateral condyle, there's the medial condyle, lateral, medial, head of the fibula is hiding there. They cross, and this looks very painful. So because they cross, they are cruciate. This one's the first one from the anterior side, so it's the anterior cruciate ligament, or ACL. That's the one Clay Thompson ripped. This is the posterior cruciate ligament. It's coming from the back, so they form a cross. So here's the posterior view, medial condyle, lateral condyle. This is the posterior cruciate ligament. This is the anterior cruciate ligament. This is actually another ligament right here attached to the meniscus. We're not going to worry about this one. So, hinge joint. The cruciate ligaments are intracapsular ligaments. They form a cross. Posterior cruciate starts in the back, anterior starts in the front, and they attach inside the knee capsule. The lateral ligament goes from the lateral epicondyle to the head of the fibula. And the medial collateral ligament goes from the medial epicondyle to the proximal tibia. Now, there's one more. There's a tendon ligament hybrid, and it's this thing right here. So the patella is hiding right there, and we're attached to the tibial tuberosity right where that screw is. So I'm going to actually scroll up a little bit. So this is the quadriceps tendon or patellar tendon. It is called that because it is attaching the quadriceps muscle to the patella. Now magically, that's a bone. That's going down to the tibia. So see, it's going from the patella to the tibia, even though it's a continuation of this. Because it's connecting bone to bone now, it is the patellar ligament. I have heard quadriceps tendon for the whole thing. I have heard patellar tendon for this structure right here as well. But we'll try to be nice and call it the patellar ligament just because that's the technical correct name for it. So that is the knee joint. Thank you.